Diabetes is one of the important health issues worldwide and causes a huge burden on healthcare and socio-economic development. In the Western Pacific region, Malaysia has the highest rate of diabetes, which costs around $600 million per year. Ironically, diabetes is interrelated with COVID-19 death. According to the Health Ministry of Malaysia, most people who died from COVID-19 in Malaysia suffer from diabetes. Alex is 55 years old this year, a retired man. In the past few weeks until now, he found out that he's having some diabetes-related symptoms such as increased thirst, frequent urination, extreme hunger, unexplained weight loss, and so on. He wants to know whether he's diagnosed with diabetes in a fast and effective way instead of being diagnosed in a blood test in a clinic or hospital, as it will take him a long time. In the medical field nowadays, there are some equipments designed for patients to self-test their blood sugar level at home. But this is one of the factors that causes diabetes, which is not considered fully diagnosed. There is a statement made by a diabetes organization in the United Kingdom, saying that a finger prick test using a home testing kit may show you have high blood sugar levels, but it won't confirm you have diabetes. In the end, the patients still have to undergo a full diabetes diagnosis in hospital.
With these limitations, here comes our project to change the situation for the better. Introducing very large-scale integration design of extreme learning machine classifier for health diagnosis application. With our project, we can predict whether a person has diabetes or not in a few seconds, compared to waiting for the result from the doctor for 3 to 4 days. Extreme learning machine can give high accuracy prediction by receiving some basic information from the user.
First off, we created the extreme learning machine in C code and run it by inserting the dataset that was prepared beforehand. The accuracy of result from ELM is calculated to make sure the ELM is functionable and applicable. The accuracy we obtain is around 70%. After that, we convert the C code into Verilog language in Synopsys and become the RTL design of the chips. We further verify the code in Verilog form by using Verilog compiler and simulator to ensure the function is the same as C code. By creating a test bench, we insert the data and compare it with the data prepared. The output of VCS show all the data are the same and correct, hence further verifying the functionality of ELM in Verilog code. Moving on to design compiler, we compile the design file with a constraint file to generate a DTC file for IC compiler purpose. We have also checked the violation in the file to make sure there are no violations. Next to IC compiler, we convert the DTC file into GDS2 file for chip fabrications by setting the floor plans and optimize the route in ICC. We have also generated a timing report to check whether there is negative slack or not in our design.
The target segment of our project is the patients that are potentially affected by diabetes, and doctors can diagnose the diabetes faster by using our solution. Early diagnosis and early treatment can prevent serious complications. When a problem of blood sugar is found, doctors and patients can take steps to prevent permanent damage to the heart, kidney, eyes, nerves, blood vessels, and other vital organs. With the implementation of ELM into a chip, it can be further applied in other hardware devices and produce a product that can diagnose diabetes and be easily purchased by everyone eventually. Our ELM is able to diagnose diabetes based on the input data by executing training and testing for datasets. However, in our project, we only managed to design the chip for the ELM testing. There are some improvements that can be made in our project in the future. The accuracy of the classification is around 70%, and some improvements and modification can be done in C code to make it higher than 80% or more. The RTL coding can be modified to ensure the design is well optimized, so the area can be smaller and clock frequency can be faster. Here comes the end of our project presentation. Thank you for your time.